webinar on TB. Our Joint Director TB is speaking. Adike. Okay.
Shreya, are you there?
Yes, I will
Yes,
start the
you
meeting.
can go with it.
Yeah. Good evening to one and all present here. I am Shreya Sridharan, Public Relation Officer, and it gives me immense pleasure to welcome each one of you to today's session. First and foremost, I would like to extend a warm welcome to Dr. Veerabhadraya Sir, President, IMA KSB, Dr.
Thank you.
Suriraju Sir, Honorary Secretary, IMA KSB, Dr. Jaspal Singh Talia Sir, Chairman, IMA MSN Karnataka, and lastly, Dr. Avin Alva Sir, Coordinator, IMA MSN Karnataka. Your presence adds great value and encouragement to today's session. It is my pleasure to welcome our speaker for today, Dr. Kumar Vaibhav Sharma Sir, whose experience and insights promise to make today's webinar truly valuable. And lastly, I welcome all the students who have joined us today. Moving on, to begin this session on a positive and meaningful note, I request Vedika Verma, National Council member, to present the IMA prayer.
May everybody be happy. May everybody be healthy. May everybody be free from pain. May everybody be free from sorrow. May we be the healing cure beyond every greed and lure.
Thank you, Vedika. I request Swapnil Sinha, General Secretary, to present the flag salutation.
Thank you, Shreya. We, the members of Indian Medical Association, stand here to salute our national flag. Its honor and glory shall be our light and strength, and its core shall be our course. We pledge our allegiance to it and realizing our responsibilities as the accredited members of this national organization. We swear we will dedicate everything in our power to see it fly high in the community of nations. Long live IMA.
Thank you, Swapnil. Now I request Srinidhi, co-convener, to introduce our speaker for today.
Thank you, Shreya, for the opportunity to introduce our esteemed speaker. Good evening, everyone. It is my great honor to introduce our esteemed speaker for today's session, Dr. Kumar Vaibhav Sharma, sir, a highly accomplished urologist with a remarkable academic achievements and clinical expertise. Dr. Sharma, sir, completed his MCH in urology from KIMS Bhubaneswar and has extensive experience in endourology, uro-oncology, renal transplantation, laparoscopic urology, andrology, pediatric urology, and complex open urological surgeries. He completed his MS in general surgery from Nalanda Medical College and Hospital, Patna, where he topped all surgical branches in Bihar in 2017 and was awarded the prestigious University Gold Medal for academic excellence. Dr. Sharma sir graduated from MS Ramaiah Medical College, Bangalore, and also secured an impressive All India rank of 136 in the UPSC CMS examination, following which he was appointed as Additional Divisional Medical Officer in the Lucknow zone through a presidential appointment. Sir's dedication to academics, surgery, and patient care is truly inspiring for all of us. On behalf of IMA MS in Karnataka, I warmly welcome Dr. Kumar Vaibhav Sharma sir for the today's session.
Thank you, everyone, whosoever is listening. I'm highly delighted to start this webinar, mostly because it's a World Kidney Day. So I'm highly delighted to put some of the insight, whatever I have read till now, whatever I know, and to be honest in very simple manner so that everyone should understand. Mostly the undergraduate students are there. If I'm going to use hi-fi words, hi-fi things, you will not understand. It will be very simple words so that you know, you learn, and you apply on your patients and your surroundings. So this will be like that, very comprehensive, pinpoint, and it will be very simple words. And I will try to explain things as much I can in the allotted time.
Thank you so much, sir, for joining us today. And with your permission, we will now begin the session. Yeah.
Yeah. Vaibhav sir, since President sir is having one more meeting to leave, so we'll have a presidential remarks for the today's session, and then we will begin with our event.
Sure, sure, sure.
Good evening, everyone. I don't take much of time.
Hello.
It is a very good
हाँ
move
मित्र,
from
बोलो बोलो.
MSN side. So I wish this webinar a grand success. Let all the students learn more about kidney from the teacher. Thank you all. Wish you all the best.
Thank you
Thank
very
you
much,
so much,
President.
sir, for your remarks. Sorry.
Srinidhi,
Yes, sir.
now you can start this thing, webinar. The speaker, let him continue, and at the end, I'll just give my remarks.
Sure, sir. Sure. Thank you.
Okay.
Shreya, you can take over. Thank you.
So, with your permission, we will now begin the session. Vaibhav sir,
Yeah, please.
shall we begin?
Please start. Yeah, sure.
Now, I would like to hand it over to Mokshit, who will initiate the discussion with the questions. Over to you, Mokshit.
Thank you, Shreya. Good evening, everyone. Good evening, sir. Once again, I thank you for being with us here today. So, moving on to the main segment of our webinar. So, let me start with the most basic questions of all. What are the main functions of the kidney that every medical student should remember? I know there are a lot of functions, and I wanted to know what are the things that we should remember in the first place.
The kidney is one of the very primary organ of the body, and it is supplied by at least 25% of the blood what comes from the aorta. So it's a very vascular organ. The first thing is a very vascular organ. Second thing is that the main function of kidney is to remove the nitrogenous waste which is formed in the liver, and so the nitrogenous waste product are excreted from the kidney in the form of urine. Other thing is that it also secretes erythropoietin. Erythropoietin, it is useful for synthesis of the RBCs and the blood products. The other thing is that if the kidney don't function, the patient has anemia. So this is the one of the important point what we see in CKD patient. They have anemia. Okay, the first thing, they have anemia, and the nitrogenous product is not moving out. So they have the raised serum creatinine levels. So these are the two things what we see in a CKD patients. So it will be present in that. The third thing is that also the 125 dihydroxy cholecalciferol, that is the vitamin D, active form of vitamin D, is formed in this kidney. So this is the primary function of the kidney what we are seeing. Other thing is that whenever there is a loss of volume of blood, or we have dehydration, or we have loss of fluid, so in those cases the RAS system is activated. The RAS, renal angiotensin aldosterone system, that regulates the blood pressure of the kidney arteries and veins, and that regulates the filtration of this part. So one of the most important part is the filtration and formation of urine, through which the nitrogenous products are excreted from our body. Other thing is that erythropoietin. The other thing is that 125 dihydroxy cholecalciferol is found in that. These are the important function of the kidney what we see. If you some growth factors also form. So in the children where the kidney is not working, like they have many diseases like cystic diseases, or the kidney is not formed. So they have early CKD. In those children, what we see that their growth is also hampered because of the same thing.
Right, sir. So moving on to next question. Sir, why do you think kidneys are often called silent organs when it comes to diseases related to the kidney?
Okay. The one thing is that why this is called silent organ, because see, the kidney is also a very sound organ also, because I believe very sound organ, and what you believe is a very silent organ. This is because the thing is that why I believe it is sound organ, because whenever you have a calculus, a stone, either in the ureter or the kidney, it produces a lot of pain. Plus the second symptom, it produces hematuria. So you see in the urine that the urine is red in color. You get so much terrified and come to us, do we evaluate that? So it's a very sound organ also. But what you have asked was silent. Why this is silent? Because we have two kidneys, okay? So before it present as a CKD, the chronic kidney disease, before it deteriorates that much that your body cannot compensate. You just understand one thing, homeostasis. Anything happen to your body will try to compensate that. Anything happens, your body will compensate. So this is with the kidney also. So before deteriorating that much that you have lot of symptoms and your body cannot cope up with that, it's too late for the kidney, because we have two kidneys and they work simultaneously, not one another. They work simultaneously. Before 30 to 40% of kidney is lost, it does not produce any symptoms. It does not produce any symptoms. So it's silent organ. Otherwise, in infectious stone, I told that the stone is very sound. In infectious stones, what happened in that, there is infection and that is the nidus for the stone formation. When the stone is formed, it gets accumulated. Like we call it a renal staghorn stone, triple phosphate stone. So in those cases, it acquires the shape of the calyx. If this is the kidney, this is the calyx, it acquires the shape of the kidney, it blocks everything. So before it presents, it is very large stone, and the kidney function is deteriorated that much before it becomes very symptomatic. We have seen sizes of 6 to 8 centimeter of staghorn stone, and there's no symptom to the patient. Either very minimal symptom of very mild pain, for which we went for the ultrasound, we saw that this size of a stone is formed in the kidney. That's why it's a very silent organ. In the CKD progression, if kidney is not deteriorated 30 to 40%, the overt symptoms does not occur, and that's why it's called the silent organ. For me, it's both the sound organ and the silent organ.
Right, so you talked about kidney being the silent organs as well as the sound organs. So it's would you tell us what are the earliest warning signs that usually patients present if they have kidney disease?
Okay, what are earliest signs for the kidney? So what I see that kidney, okay, I told that 30 to 40% is deteriorated. Okay, then it produces symptom. Earliest sign can be, I still remember the story of my son. He used to get, he has disturbed sleep. He used to get daytime sleepiness. So my sir also told that, sir, आप check क्यों नहीं कराते? आप check करा लो एक बार, आपको इतना नींद आता है, that is not normal. So he got it checked and he had CKD. Can you imagine a surgeon who was working, who had units, who was working, who was teaching, who was operating, doing everything? He had just daytime sleepiness. And one of my seniors are told, get it checked. And he landed up in CKD and he got the renal transplant also. So symptoms can be nausea, it can be vomiting because of uremia, it can be hematuria, it can be fatigue, daytime sleepiness, loss of sleep timing because of uremia and all, and other overt symptoms like anemia. So anemia can present as lethargy, then loss of concentration is there. So these are the things which in which these are the overt symptoms. Plus, what symptoms you see easily, it can be frothing of urine. Frothing of urine means, see, this is the glomerulus. Okay, the kidney has a glomerulus. The functional unit of kidney is nephron. It has glomerulus. It is the filtering part of that. Okay, so it prevents the albumin to come out of the body. So when microalbuminuria happens, it presents as frothing of urine. So this is one of very common symptom. When the patient will come to you and he will say, sir, I have frothing of urine. Sir, झाग बन जाता है. Sir, pot में झाग. मैं पहले नहीं बनता था, अभी पूरा झाग बनता है, whitish होता है. So this is one of the symptom where you get him checked with the relevant investigations so that we can catch what disease he is having, what stage he is having. So these are the symptoms in which the patient will present.
Right, sir. So now we know the warning signs, we know the symptoms. But I'd like to know how common are chronic kidney diseases in India? What is its prevalence and how often do we see them in our hospitals?
See, the prevalence, if you talk about in the worldwide, is 12%. In India, if you talk about 8 to 9% of CKD, and it has a rising trend. Rising trend because of the eating habits, rising trend because early diseases, rising trend because early diabetes, early hypertension. So these are the causes which is causing that. It's a rising disease, and the incidence is rising, also the prevalence is rising. So 8 to 9% you can say in India, and 12% worldwide CKD patients are there.
Yes.
Himani is asking why
now,
frothing is there. I will explain it after this session. You'll ask it after the session. Question answer we'll take. We'll take no issue. We'll take that.
yes, sure, sure. So for now, there is, we know that usually diabetes and hypertension are considered leading causes for kidney failure. Can you let us know why diabetes and hypertension are considered danger or risk factor for kidney failure?
Okay. The first thing is that if we take one by one, so these are the two accelerators of the kidney disease. Accelerators. If you are going to have a kidney disease, and plus if you have hypertension and diabetes, this will accelerate it. So in those patients, I always advise get it checked. Now, why it is common in diabetes and hypertension? So we will take one by one. In hypertension. So in hypertension, what happens? See, hypertension means the blood pressure is rising. There are a lot of causes for that. One is the essential hypertension with the age. Second is that eating habits and all, plus the high sodium intake. Second is that high sodium intake. What is high sodium intake? More than 2200 to 2300 gram per day, if you milligram per day if you're taking. So it means that what sodium does, it causes the angiotensin to work more on the blood vessels. It sensitizes the blood vessels to the for the angiotensin, and this causes again the rise of blood pressure. Plus the sodium causes increase in the intravascular volume. So this is one of the cause for that. Plus what hypertension does, hypertension means the increase in blood pressure is there. When it goes in the kidney, I told you that 25% blood is supplied from the aorta and the whole body. So in those cases, that high blood pressure causes the oxidative stress in the kidney, that causes the fibrosis in the kidney, and that changes again cause that vicious cycle again and again, and that promotes this CKD disease. That's the one part of the nephron is tubules. Tubules are the most sensitive part of the nephron. You can say tubules are the girlfriend of the kidney. Why girlfriend of the kidney? If it gets destroyed, everything is destroyed. So even in obstructive uropathy, like stones and all obstructing the ureter, tubules are destroyed first. If you have diabetes, hypertension, tubules are destroyed first. So tubules are the most common part which are destroyed first in this. So hypertension causes the increased blood pressure, and that causes the increase in that what you call the fibrosis, oxidative stress, and that causes this changes in the kidney. And again, that causes the pressure on the intrarenal vessels. Again, causes the increase in the RAS system, and again causes increase in the hypertension, and this vicious cycle goes on. So this is about the hypertension, how it destroys the kidney. The second thing is that if we talk about diabetes, how diabetes happens. See, the first thing is that kidney has two functions. One is it causes the glucose to go out. Second thing is that it filters the glucose, you can say. So it destroys two types. If the kidney is not working, glucose is not filtered out. Okay, it's the glucose is rising up. So this again get desensitized and causes changes, insulin resistance, and causes that insulin resistance. Okay, it causes that diabetes. Okay, the second thing is that when the kidney is destroyed, more of the glucose is filtering out. So the important thing is that glucose in the kidney. So the glucose in the kidney, what happens that in glucose in kidney, it activates the polyol pathway. What is polyol pathway? When the glucose is more in the kidney, it gets oxidative stress. That oxidative stress converts the glucose to sorbitol, and this sorbitol again causes that oxidative stress, reactive oxygen species. This again destroy the glomerulus, tubules and all, and the vicious cycle goes on. So that's why we say in the diabetic patients, always control the glucose level. If you have a controlled glucose level, that CKD will come later. We can control that. If the glucose is not controlled, glucosuria will happen. In the urine, glucose will come out. It will again cause that destruction in the kidney, and this again will goes on. So these are the two things, hypertension and diabetes, that is prevailing a lot in our this society, and that is causing the increase in the incidence and the prevalence of the CKD.
Yes, sir. Sir, about related to our age group. Sir, are we seeing that is there an increasing trend in the kidney diseases in the students and young adults these days?
Yes, obviously.
Excuse me, sir.
See, even in, if you can say, even in the children, in the pediatric age group, the kidney diseases are increasing, and even the younger age group is increasing. The most thing I attribute it to is your eating habit. See, what you eat, your body will react, you will become. Eat clean. Whatever you're eating, eat clean. Nowadays, we are more profound for the junk food. Mobile उठाया, order किया, खाना आया, खाया. We don't give it a thought that what we are eating, what is the effect of it on our body. Still, I eat clean. Whenever I go to hospital, I carry my own lunch because I cannot eat that again and again. It's been 3 to 4 months I have eaten outside something junk food, you can say, 4 to 5 months. So I will recommend to the young generation, don't go for the junk food because it has lot of this refined carbohydrates, refined fats that is destroying our immunity, that is destroying our pancreas, that is causing the diabetes, that is causing the hypertension. They have more of the salt that is again and again causing this disease, and that is attributed more because the young population is having obesity. If you have obesity, you will fall a prey for the diabetes, you will fall a prey for the hypertension. This is all over-related. What we call that in obesity, one syndrome is there. I am forgetting that one obesity that I'll tell you that that syndrome is there. In that hypertension, obesity, diabetes, it goes on and again and again. So that's why it's more increasing in our younger population. The eating habits. They don't exercise. One of the most important thing, you have to keep active. You have to exercise so that your joints and muscles are working, plus you are losing whatever you are eating and your mind remains fresh. One of the positive attitude for exercise is that it secretes endorphin in your brain. Endorphin, yeah, metabolic syndrome. Thank you, Arushi. Metabolic syndrome. So it increases that endorphin into the body, sorry, in the mind, and that makes you happy when you exercise. So you are losing fat, you are losing energy, you are keeping yourself fit, you are avoiding fat, and you are happy. So exercise is one of the most attributable thing. What I will suggest the younger generation to do is, still I go to gym after 12 hours of duty. It makes me happy, it keeps me happy, it keeps me sane. Yeah, next to you.
Excuse me, sir. Sorry to interrupt.
Yeah, please.
Sir, we would like to display the questions on the meeting. Is that fine with you, sir?
Yeah, please, you can
Okay.
display, no issue.
Yeah. Srinidhi, you can display the questions.
That will be good for the audience also, whatever they are joining and all.
Is my screen visible, sir?
No, it's not visible now. Yeah, now it is visible.
Yes.
Mokshit, you can continue.
Yes, yes, I will continue. So, sir, coming to the next question,
Yeah.
what lifestyle habits among young people can damage kidney health over time? Like, what do you think are the most common causes that causes kidney damage,
I discussed
especially?
this, that eating habits, eating a lot of junk foods, eating refined carbohydrates, refined oils and all, and not exercising. These are the most important thing which is destroying our young generation, and they are falling prey to diabetes, hypertension, obesity, metabolic syndrome, and resulting in the chronic kidney disease.
Right, sir. Moving on, how much water intake per day is healthy for an adult? In the sense, in common, can you explain in a common people terminology so that we
Okay,
can
common
understand
people
better?
term. See, everybody asks me, Nopati, how much water should I drink? So what I will tell you, that the color of urine is light straw yellow. If I say you, so this is the color of the urine. This is the color of urine, light yellow color. So what happens in that? I always advise to my patients, to everyone, I think the capacity is reached. Can't we have more than 100 people? I'm getting messages that they can't join. Only 100 participants can join.
No, I think more can join, but we have a capacity of more than 200.
No, it's 100 only showing. You're getting a message that I cannot join. Can you check
Yes,
it out?
sir, it is only 100. I'll share you the YouTube link, sir.
Yeah, please share me now. I'll share in the group. People are
I'll
asking.
just sharing you in the
Okay.
message, sir, right away. You got it, sir. I have put in the chat.
Oh, not getting that. Can you send in the WhatsApp group, please? I'll discuss this part. Please forward in
Yes,
the
sir.
WhatsApp. Sir.
I'll send, sir.
Yeah. So how much water intake is good for a patient or anyone? So what happens in that? What I discussed with the patient, that if you are working in a humid environment, if you are working outside, or if you are working anywhere, like in a hot, humid, in any furnace, any metal industry where temperature is high, you should bring that much of water that it produces the light yellow color of urine. Either 2.5 to 3 liter of water is okay for you. If you are working in an AC environment or this, you should bring 1.5 liter is enough for you, so that the urine is light yellow in color. If you're getting a concentrated urine, you should increase your water intake. So I don't recommend this much water you should take. I recommend that much water is good for you, which produces a light yellow color of urine, because our body has got homeostasis that causes the urine to get concentrated. Okay, that causes urine to get concentrated. So if you bring less amount of water, urine will be concentrated, more yellow in color, and the patient come with that, I am having a high colored urine. So I always advise, no, it's not high color. It's only because of that you are not taking sufficient amount of water. So you're working in an outer environment, 2.5 to 3 liters is enough for you. You're working in a hot, humid environment, this much is enough for you. If you're working in a AC environment, like we are sitting doing work, 1.5 to 2 liters is enough for you. So I recommend that, like that. Oh, so normal it is 1.5 to 2 liter you should take per day, and increase is as you produce a light yellow color urine.
Yes, sir. Moving on to the next question. So, as we know, the summer is coming up, and the common question among people is, does the summer or in case of gym going people, would intense workout lead to kidney stones or kidney injury?
Yeah. So what I recommend in those patients is same. This is also same. Dehydration during summer is very common because we have to travel. We are Indians. We cannot sit and do all the work. We have to travel anyhow. We get the sun, we get the temperature exposure, we get the sun exposure. So in that thing, I recommend the same thing. You avoid that heat stroke, avoid that hot environment, and drink 2.5 to 3 liter of water. If a working intense workout you are doing, you will lose at least 500 to 600 ml of body fluid. So in that case, also in gym going person, I always recommend you should take enough amount of water, 2.5 to 3 liter of water for those patients, for those clients, because whatever the sweat we are losing, I want to replace this, because dehydration is one of the most common cause for stone formation. And if we are not taking a ample amount of water, stone needles will form the small particle, what the sub Render's plate, and in that the stone will keep forming. So I always recommend drink 2.5 to 3 liter in summers, and if you're working out in gym, 2.5 to 3 liter is enough for you. To avoid from kidney, like acute kidney injury, if you're more dehydrated, that leads to acute kidney injury, and stone formation is more in those patients who don't take enough amount of water. Over to you.
So now we know the signs, the symptoms, and how much water we take. Uh, so coming to this now, what do you think are the basic tests that one should get checked when we go for a routine investigation for related to renal systems?
Okay. So what are the kidney stones so common in India, and this why kidney stones so common in India? How can they be prevented, right?
So that next question actually.
Kidney is so India has a lot of that equator passes, and India has a lot of that what we call hot climate area, and that is the belt for stone formation. Because in our condition, the laborers, the workers, and even any man don't get give that much attention for the hydration, and the dehydration part producing less amount of urine. It's scientifically proven that less amount of urine, dehydration, precipitate the stone formation in kidney. So what I suggest, hydrate yourself well whenever you're working in the outside. So in India, the men who are working outside, the women who are working outside in the field, in the furnaces, in the steel factories, where this is hot, they should hydrate themselves 3.5 to 4 liter of water. They should keep themselves cool, avoid that hot furnaces how much they can, and the stone can be prevented in those cases. Over to you.
Right, sir. Yes. So, sir, what basic tests can we expect to check for kidney function when a person walks into a hospital? Let's say.
So, in okay, so one of the most important kidney function tests is that what you see your urine. What is the color of your urine? How much amount of urine you are producing? The second thing is that is this frothing or not? Is there in hematuria or not? What is hematuria means? The reddish color urine or blood in the urine. So I want the first thing is the physical thing, that what is the color of the urine, what is the amount of urine. This is the most important thing that that a patient can tell you. Second thing is that if you go for the lab investigations, so in the lab investigation, the most important is your urine routine examination. It is ₹100 test, urine routine examination. If I show you, it has lot of information. What information you can get? The first thing, are you overhydrated? What is the specific gravity of the urine? What are the casts present? Is there any RBC? Is the RBC dysmorphic or RBC is intact? So in the pre-renal causes or glomerular causes, that the basement membrane is not working, glomerulonephritis, the RBC is distorted, dysmorphic. If you go to dysmorphic, distorted. If you go for post-renal causes, like in the after the kidney, the RBC will be intact. The shape of the RBC will tell you what disease we are dealing with. That ₹100 test, urine routine, it will give you information about the RBC. Bacteria is present, nitrite is present or not. So bacteria, nitrite, and the pus cells. If three are present, UTI is confirmed. You can start the antibiotic. The third thing, important thing is that in that the crystals, what you asking about the stone and all, stone and all, stone and all. If I'm finding a crystal in the urine, it means that the patient will form a stone in the future. So we have to take care of that, what crystal it is, how we can modify the diet. Other thing is that renal function test. In the renal function test, you can easily get to know, and plus the presence of sugar in the urine routine is very important. The diabetes is controlled or not. This is one of the most important aspect of the urine routine. What I prefer to get from all my patients is the basic ₹100 test. I get a lot of information. Second thing is that if I am doing this renal function test, it has creatinine. What creatinine tells you that what is the amount of protein turnover in your body. What is the amount of protein turnover in your body? The creatinine tells. The second thing is that EGFR. So EGFR, GFR means glomerular filtration rate. So it tells about the kidney disease, chronic kidney disease is there or not, what stage is it is, and how we can prevent it. So EGFR, creatinine, urine routine, these are the very important three tests what I always get from my patients. So for the EGFR, if you go for the creatinine, creatinine is formed in the body, it's a very important and very reliable marker. So this tells about what is the turnover in the body, and is the kidneys functioning or not, so that the serum creatinine is rising. If it's not working, if it's working well, it is in the normal range. So these are the basic tests you should get from all your patients if you are suspecting any kidney disease. Over to you.
Yes. Yes, sir. Coming to the next question, sir. So we talked about kidney routines. What are the tests to get that we should get done? So what age people do you think, or which group of people are should get their kidney routine done regularly?
What age of the risk group? Already told
Yes,
that
sir.
the age and the risk group. So age is not specified that much. The patient is having symptom, or is a patient where you're suspecting hypertension or diabetes, you should get as early as possible. So I recommend at least 35 to 40 years of age, because see, the number of nephrons are fixed when you are born. After 25 years of age, it keeps declining. So the serum creatinine will be at a higher level in that age. So after 40 years, I always recommend to get a RFT, a kidney examination done, a urine routine done for those. If the patient is diabetic, if the patient is hypertensive, I always recommend that yes, you should get it frequently, at least 6 monthly, to check for what is the condition of your kidney, how it is functioning, what is the turnover, is your kidney losing that sugar or not. So I recommend in that age group early, like 40 years with diabetes and hypertension, and 45 you can see in the normal patient. I always recommend. Plus, if the patient is hypertensive, early hypertensive, or he has any feature or symptom of like facial puffiness and all that, I always recommend 6 monthly to get it done.
Right, sir. So nowadays we are seeing more of these promotions and all regarding creatinine monohydrate supplementation. Do you think it will damage kidneys in healthy individuals?
This is one of the very vast, very debatable topic, you say, but because whenever I go to gym also or anywhere, people keep asking about me about this. So let's clear the myth about that. What is creatinine monohydrate supplementation and all? See, creatinine, it provides a very good amount of energy for your body, so that you can work out, intense workout. Second thing, it helps in recovering the body. What is a gym? What happens in gym, if you understand, you'll come to know. In gym, we causes the tear of that. We tear of your muscles, okay, and then it again heals. So that causes the hypertrophy of the muscle, wear and tear, wear and tear. So the recovery is the most important part. So whoever is the bodybuilder, they need at least 8 hours of sleep. We cannot get 8 hours of sleep. It's a dream for our doctors. So that 8 hours of sleep is very important, because the recovery should happen. So the creatinine helps in recovery. So the first I told you, it provides a lot of energy. It creates the fat into fatty acid, that is again used in the energy. It helps in fat loss also, the creatine monohydrate. And damaged kidney, in the damaged kidney with creatinine supplementation. See, there are a lot of meta-analysis. Meta-analysis means a lot of papers are being scrutinized. So in meta-analysis, they have found that you are taking creatinine from outside. Our body produces this because of this turnover of the muscles. Okay, so the body has 1 gram already. You are taking from outside, the amount is more. So the recycling is more. So if you measure the serum creatinine, it will be little higher, but it does not affects the kidney. It does not affect the kidney. It does not affect the kidney function. Just you'll find that serum kidney is a little higher than the earlier stage when you are not taking that. So the taking creatine monohydrate does not affect your kidney, does not progress your kidney for the chronic kidney disease. But still, what I feel, your kidney is like a 800 Maruti 800. You can't make it Ferrari, right? So if you're taking creatinine, if you're taking supplements, you should take more amount of water, so that it gets washed out. The whatever extra is there, it gets washed out. So whenever taking creatinine, take at least 800 ml to 1 liter of water more, so that it gets washed out from your kidney. Otherwise, it has no effect on kidney, no effect on CKD, no effect in progression of the CKD or any needles for that. Till now, what the meta-analysis they have done.
Right, sir. Sir, about this, we also have a common doubt regarding protein powders also. Do you think are
Okay.
they harmful to kidneys?
The same thing happens with the protein powder. What is protein powder? You're taking a protein like whey protein, the very refined form. Why you're taking whey protein? Why you're taking eggs and all? I prefer eggs and chicken more than the whey protein because it's natural and but the more important thing is that bioavailability is less. Whatever bioavailability means, you are taking 100 grams, getting digested. Whatever is going to your body, your muscles is very less in those cases. And what you take a whey protein is very refined form. They get absorbed and your body is getting. Same thing in the creatine monohydrate. It helps in recovery of this. It helps in the nutrition of the muscles. So I always recommend with a high protein intake or protein powder, they're not harmful to the kidneys. They're not harmful. But if you are taking them, take not more than the recommendation, like 1 milligram per kg body weight, not more than the recommendation. Plus, you should get yourself checked every 6 monthly or one yearly if you are a professional athlete. Apart from that, same thing, 500 to 800 ml of more water to take so that your kidneys are not affected. It will get washed out from that. So this is the myth about the high protein and the serum creatine that they destroy the kidney. No, they don't destroy the kidney. There are a lot of meta-analysis, a lot of papers are there. If you will ping me, I'll send you those papers.
Yes, sir. Sir, about once again about this supplements itself, there are some unregulated gym supplements or pre-workouts. Sir, do you think these are dangerous to the kidney? Because I think
If you're taking this is more about going in a gym session. We'll discuss that. These are the most important thing everybody want to know.
Here, I want to ask one question.
Yeah, please, sir.
Be very direct. Now, all those people who are going to gym and working out,
Sir.
they have started taking creatinine as a supplement.
Sir.
So, how safe is it to take creatinine as a supplement, and what are the norms of taking creatinine?
Sir, the creatinine is very safe. I already discussed that it's very safe. Why it is safe? Because meta-analysis has been done. A lot of this investigation are done. A lot of papers are there, sir. And meta-analysis of those reveal that there's no effect of creatinine on the kidney. But if you are working out, it helps provide you energy because it gives you instant energy. Plus, it causes lipolysis of the fat. That fatty acid is used as energy when you're doing intense workout. Only the intense workout. Normal people should not take creatine. It's not useful. If you're going very heavy for your body, then you should take that. The third thing is that it helps in the recovery of the muscle. If your recovery is there, hypertrophy is there, you will see the results. So as of now, it does not produces that CKD. It does not affect your kidney. But I personally recommend if you're taking if you're taking creatinine monohydrate, that is very refined form, take with a glycogen or glucose supplement. It helps in more absorption and the effect will be more, plus more water, 500 to 800 ml of water, so that whatever extra is there, it get washed out in the time period of taking a serum creatinine levels. Okay, sorry, in the creatine monohydrate, the serum creatinine will be at a higher level because the body has this much, you're supplementing this much, it will remain in the body, so it will be a little higher than the normal value in the normal people.
Thank you, sir. Thank you for the information.
yes, sir. Moving on to the next question. Sir, what are your opinions on energy drinks and high caffeine intake? Do you think they are somehow dangerous to the kidney?
Caffeine intake and all are not that dangerous to the kidney. Only thing is that it has addiction. So nowadays, if you see that whatever supplement I take, it has 300 milligram of caffeine. So I take half a scoop because I don't want addiction. I work 12 hours, 14 hours a day in the hospital. The other thing is that if I take more caffeine, I will be awake. I will not sleep. So I cannot work again. So I want myself to have a sound sleep also. So what I recommend, less caffeine so that you don't get addiction. Plus, if you are a medico, you need lot of turnover for your work hours. So you should not get addicted. You should not be awake much because we already don't get time to sleep. Whatever time you are having, you are killing with the high caffeine diet. And if you're taking any supplement, energy drinks or supplement, I always recommend take authentic one because It's very easy to force you to provide you a fake supplement. You must be seeing every time in the paper they burst lot of gangs producing protein powders and all. So it's very unreliable. Unreliable sources should not be used. What I have found out, they provide you estrogen just like the chicken. You see chicken, na? They inject estrogen to the oxytocin estrogen to the chicken so that they grow very fast. They have a high uh, content. They increases the water content of the muscles. So in lot of the supplements which are local, which are forged, which are duped, you will get lot of estrogen and oxytocin supplements. What they do, they will they will cause your muscle to swell up, and you will say, I'm getting the result and this is the good product. But they are disturbing your liver and kidney also, and this also, plus they spike it with testosterone also. So you will also get in the later stages ED, and the ED is not good for you. Whatever patient comes from the ED is totally not good. So I don't recommend that unreliable sources or the pre-workouts or anything that is cheap or that is false. So always check your batch number, check your this supplier, that he is genuine or not. And high caffeine intake should not be taken because it does not affect the kidney, but it kills your brain and all. So you get addicted, you'll get less sleep, and that is not good for you. Over to you.
So speaking about drugs, so do you think painkillers like NSAIDs silently damage kidneys when we use them frequently, like diclofenac or aceclofenac?
See, India is a country where over-the-counter drug is increasing a lot. It's since ages. You in the evening or night, you will get pain. The patient will go directly to the pharmacy. He will take some painkillers and all. He will come. He will take heavy. So they are much more addicted to the steroids, painkillers and all. They take over-counter drug. These are the over-counter drug, and the new over-counter drug is Lenafil. So we'll discuss about this. The painkillers. What is the effect of painkillers on your kidney? So the papilla is the where minor calyx join. Okay, all the nephrons are there. They join for minor papilla, major papilla, connecting duct. So what happens to that papilla? It causes papillary necrosis, and that papillary necrosis is not good for the kidney. And slowly, this necrosis goes in that, it goes for the chronic kidney disease. So NSAIDs are silent killers for the kidney because people keep taking to avoid their pain, to their joint pain, and it keeps destroying your kidney. The same thing happens in the diabetes, papillary necrosis. This papillary necrosis again destroys the kidney. Plus, in the CKD diseases, with diabetes, what happens? The kidney is a single root organ. This is kidney, this is the ureter. Urine will come from this to this. The papillary necrosis blocks it. If it blocks, it becomes infected and the pus is there, and that causes the emphysematous pyelonephritis. So papillary necrosis is not good. Most commonly seen in NSAIDs and the diabetic patients. So yes, NSAIDs are the silent killers, and they are one of the most important part, which is increasing the incidence and prevalence of the CKD in our society.
Right. So speaking about this, when we go to the other end of the spectrum, there are herbal medicines and there are alternative medicines. Do you think are they always safe for kidney, or are there some ingredients that cause damage to kidney function?
Okay. See, I always support every allopathy, like allopathy, homeopathy, Ayurvedic. I support every form of medicine because when we don't have surgery, the Sushruta, the father of Ayurveda, he was the first to perform rhinoplasty. So I respect every this form of the medicine what we study. But what I found that in Ayurvedic medicines or herbal medicines, if they are not checked, they have a lot of heavy salts, mercury, potassium, and all. And high potassium is not good for our kidney. High sodium, high potassium, this is not good for our kidney. And they have a heavy salts, mercury salt. So what I have found in this case is that What personally I don't recommend Ayurvedic herbal medicine, but I don't cut also, because if patient have faith in that, let him take. I do explain the consequences, that yes, it has heavy salt, this can destroy your pancreas, this can destroy your this can get accumulated, this can destroy your kidneys. But if you want, you can take. Its decision is up to you. You cannot stop any patient. Same like in dengue, there is a myth that the milk of the goat increases the platelets. I have worked in Karnataka in Ramaya. I was an intern. Every night I used to see a lot of dengue cases and all the referred cases. See, once the platelet start increasing, it will increase very fast. So the most important time is the increase of the platelet. So what I have found, that don't stop them taking that goat milk. Let them take. You start your medicines. You do whatever you want. Patient will recover. He is happy. You are happy. So yes, herbal alternative medicines are not safe. What I have found out. So I don't recommend for the patient for the long-term use.
Yes, sir. So you have talked about the importance of water, but can you also tell us, is excessive water intake harmful for kidneys?
Yeah, it is, but not that much. Only thing is that you will produce a very white urine, and you will get a lot of you get frequency of urination. So it will only disturb you if you're taking a lot of water. So a lot of water is not harmful for the kidney, but it will cause a lot of nuisance to you only. The same thing I have told you. Kidneys like a Maruti 800, don't make it a Ferrari. So whatever the worth is limited for that kidney, liver, and all. So let it be consigned for that only. So excessive water will lead only problem to you, that you will produce lot of water, lot of urine. You will have frequency of urine. When you sleep, you will wake up. So this will cause lot of this difficulties for you only. So yes, excessive water is not that harmful for kidney, but it creates lot of nuisance to you.
Uh, right, sir. Moving on to next question. Sir, can you tell us about briefly what are a few important habits that we can inculcate in our daily lives to keep our kidneys healthy?
Okay, चलो, so इसको discuss करते हैं. This is a very important thing. People are asking, how can I keep my kidneys thing? So first thing is that hydrate yourself. 1.5 to 2 liter of water is the minimum. If a hot and humid environment, you should take more amount of water. The urine should be light yellow in color. That's it. The first thing. Second thing is that restrict your salt intake. I told you already, 2200 to 2300 milligram of salt is enough. Less than that is enough for you, because that sodium chloride increase intravascular volume also sensitizes the aldosterone to the blood vessels. It sensitizes, it causes the essential hypertension, the hypertension in the patient, that will again damage your kidney. The third thing, lot of nuts, lot of chocolates, lot of potassium. High potassium is also not good for your kidney. So the food which is high in potassium should be avoided. The fourth thing is that I told you, lot of nuts and all is also not good. Dark chocolate is also not good, because they are the precursor for the stone formations. The one of the most important thing is that high protein diet. What I recommend to my patients who have a stone, because 50% will again form a stone in again 2 years. They ask me, sir, will I develop again? I say, yes, you will develop. There's answer 50%. You are lucky if not in the 50%. So in those cases, I recommend them to don't stop, just restrict your protein intake. Restrict means take less amount of chicken, less amount of dal, less amount of protein, less amount of eggs, and lean meat. Lean meat means like fish, chicken. In chicken you can reduce the quantity of that. So these are the lean meat which is easily absorbed and easily recycled from our body. So these are the 5 things which what I always recommend my patient. Good amount of water, less less salt, less potassium rich foods, less protein diets and all in those patients, and less chocolate, nuts and all, because they're predisposed for the stone formation.
Right, sir. So now coming to the next question. So we have talked about important habits. So what are some special habits that patients with comorbidities like diabetes or hypertension should take to protect their kidneys?
Yeah. If I go simply telling that I discussed already. So in diabetes and hypertension, diabetes I told you, kidney is a one-way system. So it blocks If papillomavirus, it blocks the system, it gets infected, patient will have a lot of fever, you will keep prescribing antibiotics, he will not heal. Until unless I intervene, just intervene, it will not heal because the necrose part has blocked the ureter. So I have to intervene, I have to put some guide wires, some DJ stent, and that this flank of this pus will keep coming on that, pus will keep coming on that. So that is one of the things that in diabetes patient, the high sugar kills your kidney. So you should restrict your sugar levels. Do daily brisk walking is very important in that diabetic patient. I always recommend brisk walking for half an hour. Control your sugars. Take your diet well. It should not be a high sugar diet. So dietitians are sitting for us. Take a good diet chart. Follow that. Take your medication, whatever suits you to control your diabetes. Either let it be OHA, oral hypoglycemic, or let it be insulin. It should be controlled, because diabetes is a silent killer. It will cause diabetic retinopathy, diabetic nephropathy, and a lot of diseases. It will diabetic foot, and lot of diseases it will cause. So this is for the diabetes. A good sugar control, a brisk walk. Other thing is that in hypertension, I told you the hypertension, less sugar intake, less salt intake is very important. Take your medications, because not only hypertension causes kidney damage, the stroke in hypertension is more devastating. The patient will land up in bed with paralysis, with this, and this is not good for the patient, because that is very, I don't think that is a good thing to land up on bed after this stroke and paralysis. So yes, hypertension, less amount of sodium, good medicines, control it, get it checked, get your kidneys checked, get your heart checked already, because it has a good connection with the heart, also hypertension, and stay healthy with that. These are the precautions for the people of the diabetes and hypertension. Over to you.
Thank you, sir. Sir, we'd like to know what are the common misconceptions that you hear from your patients, especially about kidney health? The misconceptions. What are the misconceptions?
Misconceptions. Okay, one of the most important thing, I'm a renal transplant surgeon, so I have to convey them that yes, with one kidney you will be fine enough. So they think that one kidney is not enough for them. So we have to counsel them a lot that yes, your patient needs, because dialysis is not good for the patient. It's devastating to again and again go for the dialysis. So I have to tell them again and again that yes, your kidney is very important. But if your patient will get your kidney, you will also be healthy, he will also be healthy. So this is one of the myths, is that with one kidney you will not be alive. So I give them example of the patients who have agenesis of kidney, or who already have nephrectomy due to other reasons. So this is one of the biggest myth about kidney, that one kidney is not. Other myth is that they say that one kidney will keep working, one will be in reserve. When this will destroy, this will keep working. So I tell them no, they work simultaneously with that. The other thing is that for this myth is that they are not convinced that kidney is one of the organs that keep them healthy, because the uremic symptoms occurs in the patient, that loss of sleep cycle occurs because of uremia, that growth is not there, they have anemia, they are weak. So I always explain every possible way they should understand why kidney is important for them. And the blood is not low because of they're losing blood, but because of the erythropoietin not formed in those patients. So these are the myths which I keep telling my patients about that. Over to you.
Now, going to the next question. So, what should medical students or the young doctors remember about early detection of kidney disease?
I told you that if the patient is telling you symptoms, what symptom patient can have? See, the first thing is the raised creatinine level. Second thing is that he is not forming much of the urine. Urine is not that much. He will tell you, sir, I'm having very less amount of urine. Plus, someone asked me frothing of, what is frothing of urine? See, these are the glomerulus. They have the cells, podocytes, which have interconnected cells. When these cells are lost, okay, the filtration happens more, hyperfiltration we can say, and the microalbumin from our body is losing from there. So that whitish urine, frothing of urine is one of the common symptoms of patient will take, because he will be passing urine, he will come to tell you, sir, I am having frothing of urine, fena fena, jhaak ki tarah. Aisa they will use the words. So you'll get click that, yeah, he is losing albumin, maybe albumin. So we have to discuss that with the patient that yes, it can be, we have to evaluate you. Other thing is that if he is having hematuria, like urine in the blood, blood in the urine, then you should suspicious about other causes, glomerulonephritis, renal cell carcinoma and all. So color of urine, amount of urine, frothing of urine, redness of the urine, these are the things, and any suspicious thing you are seeing in the urine routine examination. Over to you.
Sir, I have one question.
Right.
Yeah, please.
Sir, if I'm permitted,
Yeah, please, sir.
अभी ऐसा है ना, it's something like 100 चूहे खा के बिल्ली हज जाना चाहती है.
Yes, sir.
All that which has happened due to excessive intake of proteins or excessive intake of anything like excessive drug
Sure.
abuse,
Oh, yeah.
supplements, and alcohol, or excessive workup and whatever. So, and the personality has not realized that what he was doing till now is something which is has caused insult to the kidney. Now, if this personality wants, the kidney still can have an option for him, that he can do something, that the kidneys can be, going back.
Reverted back.
Yeah.
Yeah.
Rebooting of the kidneys.
Yeah, why not? Every organ has a regenerating capacity. Kidney has less. The liver has the most regenerating capacity of the body. So in those cases, if I see what is the stage of the chronic kidney disease, what is the EGFR, like 90, 90 to 60, 60 to 30, 30 to 15, less than 15. So if it is 3A or 3B or 4, so in those cases, I recommend my patients, you should take care of you, check yourself, keep checking yourself, leave whatever has destroyed your kidney. If you have diabetes, keep it strict control, strict control. If you have hypertension, strict control, and we will follow you. There are a lot of medicines. The medical field is growing fast. There are a lot of medicine. Everything has a cure, supportive or non-supportive, you can say. So we provide the supportive medications for those kidney, so the patient don't deteriorate further than that. And yeah, many patients do recover. If your body has a strong regenerative capacity. You cannot tell who has not. You can never tell that, and it's different for the everybody. So yes, if it is in the range of 3A, 3B, or 4, I recommend my patient that yes, you will have a good kidney function if you follow. And if it is in the stage of 2 or 1, less than 30, less than 15, you cannot do anything. Kidneys are already destroyed. Its fibros is very small. So the only alternative left is that dialysis, renal replacement therapy, either in the form of dialysis or in the form of renal transplantation. So whatever is there, when the patient, what is there, so chuhe kha ke billi. So I explain that every part to the patient. He should understand the intensity of the treatment or intensity of what you are going to tell, how we can save his kidney or we can go for a renal transplant. What are the pros and cons of that?
Thank you, sir. You have explained very well. So every person can still have a hope.
Right, sir.
He complies to the required norms in a proper way. Then,
right. How much they strictly follow your advice? How good they want to be good? How much they want to recover themselves?
Yeah.
Same as it in stroke patient, physiotherapy helps a lot. If they are dedicated, they want to walk, they walk. You might have seen, sir, a lot of patients walking after stroke, after paralysis. They are good. They are doing good. It's just the willpower, how much you want yourself to recover.
Right, sir. Thank you very much. Thanks a lot.
Right, sir. Thank you, sir. Sir, we've talked about a lot of things in this session and a lot of good things, in fact. But if you would like to summarize everything into a message, what is the message you would like to give us, the young people, about protecting our kidneys?
I advise every young people, every medico, balance your life. Studies are very important. Do study, but do give a time to your body. body means you should exercise, eat clean. It's not possible that much. Even I was in Bangalore. I was in Ramaya Medical College for 5.5 years. I hardly felt ill there. I think in 5.5 years, 2 times I fall ill, and not more than that, because the eating habit was good there. So I always recommend eat clean, eat good, give time to your body, exercise either in the morning or after classes or after evening. Keep studying, do regularly, check yourself if you are a gym person, check if you are a high intensity workout person, do check that with the renal function test, get your CBC done and all. A routine checkup you should get done every yearly, because you don't know whatever, when what will happen, and when we can save you. So that is most important thing. There are a lot of patients that they walk at the ship. He came. He was a ship. He was walking in the ship. He came that I was very lethargic and all. I got checked. I got CKD. I was very shocked that he has not any symptoms. And within 6 months, he was a CKD patient with this dialysis and all. And what God has done, one diseased renal transplant happened to him just last month. He has applied for the diseased renal transplant. One patient died because of RTA. Their family were very good there. They donated the organ. He got that. So it's just a part and part of life. So you should take care of yourself. Get yourself checked. Eat clean. Less salt intake. Good water intake. Do exercise. Whatever you inform, yoga, exercise, gym, running, cricket, anything, and give time to your studies. Studies are very important. If you have knowledge, you will stand everywhere.
Right, sir. Thank you, sir. Now that brings us to the end of our Q&A session. Once again, thank you, sir, for sharing your valuable time and your knowledge with us. For having we had such an enriching session. Thank you, sir. Now I'd like to.
Dr. Anuradha Parmesh here. Could I add a few words?
Sure, sure.
Yeah. I am National Headquarters MSN Standing Committee member. And the last question that you asked Dr. Vaibhav was, what is his tips for the young students, young doctors and the medical students? Well, with my 41 years of practice, both family medicine as well as gynec practice, what I want to advise my youngsters is, one, he put it where Dr. Vaibhav summarized it very well.
Thank you,
See,
ma'am.
hypertension, diabetes, all of them are asymptomatic, and we find that in youngsters they come abruptly to the emergency room with uncontrolled hypertension, and they come with stroke, heart attack, etc. So the youngsters, as Dr. Vaibhav put it, they definitely need an annual health checkup. And here you catch the thief. What is the thief? Blood pressure may be borderline, your lipids may be erroneous, and you have to take care of your health.
Right,
I
ma'am.
may look healthy, you may look healthy, but when I get my blood pressure checked, it because of the genetic predisposition, and we Asians are more prone to develop diabetes,
Right,
we
ma'am.
will we will be prone to any of these diseases. So
And the junk food.
youngsters, yeah, youngsters, yes, you will be taking lot of junk food, or you know very well where you are erring. You may be smoking, you may be taking more of alcohol, and those people certainly will need annual health checkup. But there are silent killers also amongst us. So one routine urine test, routine examination, or a simple blood pressure checkup, a GRBS, a lipid profile. These are some tips which may help us to pick up disease in the early stage, which may pick up. That's all I have. That's a message I have. Thank you.
Thank you, ma'am. Now I'd like to hand it over to Srinidhi.
Thank you, Mokshit. Thank you, Anuradha ma'am, for joining us and being throughout the session and encouraging us for the event. It was a wonderful uh, talks by you. I would like to call upon the students. If you have any doubts, sir has shared his email ID as well as Insta ID. And if you have any questions, you can directly
Yeah,
mail the
please,
sir.
please, please,
And if you have
please.
any questions right now, sir, we are open for the discussion, sir.
Yeah, please. Discussion is the
Yes.
main part. Whatever I have told is one way. If you ask, I will also learn from them because they keep learning. I am a keen learner.
Sure, sir. Sure. Thank you. Guys, if you have any questions, you can go ahead. Unmute yourself and ask the questions.
Feel free to ask. If you don't ask, you have not learned anything. And if you keep asking, if you are keep asking even in classes and all, this doubt will never happen. Even in NEET PG and all, which is the main aim of yours. So this keep asking doubt. Let it be silly. It's silly for others, but not for you. It will be a big rock for you. When you ask, it will be solved. You will never forget.
So I had a question.
Yeah, please.
This is Gaurav here. Firstly, thank you so much for joining in today, sir. My question to you goes towards, most of the times what we see is people, you know, go for, it's a little bit off topic. Like they, as interns, they contact us and ask, do we do kidney transplant here? Do we, we'll pay you this much amount of money and things like that. And as intern doctors working in DH and everything, we don't know how to answer such things because it's not ethically right for us to even outright tell no, but we should not even promote that it leads to kidney trafficking and everything. So this might be a
See,
broader question.
yeah.
So
Yeah. See, what
how
we
do
have
we?
to say in that cases, see, kidney trafficking is not a simple thing. Other thing is that it's not that easy as you think that you will be involved in that. So, what surgeons are there, what the nephrologists are there, SOTO is there, like a state organization. Then the NOTO is there. You have to get it passed from SOTO, then NOTO, then they will check every part. So the financial part, you have to say approx 10 lakhs, it will be plus you have to bring your own kidney donor. Don't say kidney will be available. Always say bring your own donor. First thing. Second thing you have to say it's approx 10 lakhs. It can vary according to the hospital. Third thing you have to say he will be asking, sir, other where from where we can get our this from where we can get our kidney. So say disease transplantation is there. What disease transplantation means if RTA is there, any brain dead patient is there, if the family is willing, you must have heard a news of 9 year, 2 year or 9 year old lady, child, she died and their family donated. So in that a register is there. In the register, you have to know, give your names and all. I told now one sailor was there in ship. He came, he got the kidney. So if your number is there, HLA matching is there, you are matching. So just say 10 to 15 lakhs, bring your own kidney donor. He will be devastated. Nobody want their relative to give kidney. First, the same as you say, na, I want 4 point of blood. The relatives will flow away. They will not stand. The first thing. The second thing you have to say, whoever is there, bring your donor 10 to 15 lakhs. Other, talk to my senior. You feel free to take help your senior. And you have to go to the SOTO and NOTO for the clearances. So never feel that you are intern doctor. I find that intern is the most important doctor of a hospital. Most important. I was also an intern. I grew up from that. I was in Ramay. I used to roam in the night for the suturing. To where can I get the suture in the night in the OBG, in the gynae, in the emergency department? So you learn like that. So never think you are a small doctor. You have spent 5.5 years learning medicine, which your co-friend doing engineering doesn't know anything about a body. You know much more about a body than him. So don't miniature yourself. Think you are enough. Keep reading everything you don't know so that your knowledge will keep increasing. Other thing, explain to the patient whatever you know. Then you say, you talk to my senior. I used to do same. Never feel that you are very small or you are a miniature.
Yes, that answers a lot. Thank you so much, sir.
Anyone else?
Do we have any more questions?
Good evening, sir.
Yeah.
My name is Kinshuk Jethi, and
Yeah.
I just want you to ask one question.
Yeah,
So,
please.
as we know, serum creatinine, we use it as one of the base tests, as
Okay.
most of the classifications involve it. Either it is a chronic kidney disorder, acute kidney disorder. Most of the classifications include it. But as on the same side, we know that creatinine has several limitations in it as a test. And my question is that most of our classifications, most of our treatment modalities are based on the creatinine levels, and
Okay.
new indicators are being researched, like interleukins and
Inulin.
gallium, inulin. So,
Right.
do in future we see
Statin.
that we can evolve from creatinine use and move toward a stable indicator for kidney disorders?
See, kidney disorder, the one important thing is that whatever is easily available, whatever is cheap, you keep it for follow-up. Okay. So in a renal stone patient, you can't do, you keep doing CT scan, CT scan, CT scan. Why? Because it has a radiation exposure, it has a cost to the patient. Same as with the inulin. Inulin you supplement from outside, it's costly. And serum creatinine is formed inside the body. It tells that what is the turnover. Little bit lower than the inulin is the creatinine. So why you want to supplement from outside and follow up the patient every time? From where he will pay? Most of the patients are very poor. Who are rich, they don't come to you. They go to a multi-specialty hospital. They have insurance. You will not see them. They will not see you. So if you are working in a setup where poor people come, so you cannot rely on those inulins, statin or other. So books keep describing the thing which is very easy to follow up. So in those cases, creatinine is the mark for us. If inulin gets cheaper, other products you can use for your kidney this tracking, we will use that. And that's why the creatinine is easy to use. We describe it on the creatinine and the urine creatinine, urine creatinine albumin ratio. Urine creatinine albumin ratio, because UACR, urine albumin creatinine ratio, how much albumin is lost per creatinine of the body. This is also indicator 30 to 300, less than 30, 30 to 300, more than 300. That is the indicator for 1 to 3 and CKD classification, what you will see. How much the kidney is losing protein, how much damage is there already in the glomerulus. So this is why we use creatinine, not inulin or cystatin. But if they ask you, tell them everything, but tell them, sir, this is easy. This is inside the body. We should not supplement. It's not costly. For follow-up, I can get it easily anywhere. So this is the reason why we follow serum creatinine and all.
Thank you, sir.
Anyone else, or should we close that?
Good evening, sir.
Yeah, please.
Sir, I have a question. Medicos will drink lot of caffeine to wake up late nights during exam preparations. So it's kind of a addiction, sir. Already, rather than habit, now it's addiction. We can't cope up with the sleep mechanism. So, what's your message for all those medicos who drink lot of caffeine, tea, all those things, sir?
Okay.
Caffeine.
Caffeine. So the one thing I always advise medicos that you should study every day, not during exams, because you want to because you want that you want to study within a week, within an hour, within a week everything. Okay, you want to study within a week. It is not possible in medicine. That's why I told you daily take out time to study at least 2 to 3 hours daily. So in exams will not be, your sleep will not be hampered, you will not be stressed out. And yes, in exams you can take caffeine and all, you can take coffee to wake up. I also used to take that, tea and all. But after exam it will become normal. But if you keep taking whole day and all, indulge yourself, fascinating is different. So keep studying every day, 2 to 3 hours. Take out time, 3 hours is nothing for you. Go sit in library. After that, go do party and all. 4 o'clock your classes get over. Go take a sleep. 5 to 8 you can study or play for 1 to 2 hours. Then you study. Then you do anything you want. So if you study daily, stress will not be there. You not get addicted to caffeine. If you were addicted to caffeine, you can leave it easily. It's not a big issue.
Sir, I will add to our convener Srinidhi's question.
Yeah.
He was limiting himself to only caffeine. I have seen many of our young generation people going in for drinks like containing taurine, especially Red Bull and Monster, for keeping them very alert and awake, and they keep on making preparations for exams. What is your take on that, sir, for them?
The first thing is that everything is now getting followed because of social media. So
Yeah.
some background noise is there. So everyone is following social media, and they are indulging because of the same thing. I advise everyone not to be on social media, that don't follow those things. And yes, caffeine is enough for you. Don't go for Red Bull, Taurine, and like a Gatorade and all. This is not needed. Until you are an athlete, you need recovery. These things are not needed in your body. Your body has everything. The only thing, what they do, the same thing. They ask me, sir, which multivitamin should I take? My patients, if they are healthy enough, I tell the same apple, they process it, they take out the powder, they make medicine, and then they will give you to eat as a pill. Why don't you eat as an apple? You'll get the fiber also, you'll get everything. Why don't you eat like that? Bioavailability little less, but it's good. The same thing happens in this. I don't recommend, I don't want you to take all those Red Bull and all. It's just a psychology, what you are going to follow. As all the social media, this talents, what they want to infuse in your body. Tea is enough, caffeine is enough. Take a proper sleep before your exam. That is the most important thing when you can write. If you're not taking a proper sleep, you cannot write. So I don't recommend taurine, caffeine, much of caffeine, taurine, and Red Bull and all. I don't recommend, sir.
Okay, thank you, sir. Thank you. You addressed that point. Thank you very much.
What one clinical mistake in neurology that can permanently harm a patient if missed early? Clinical mistake in neurology. See, everyone is now having a subscription of all the studying apps. What I recommend you to study as thus, to study clinical books, because when you do a clinical diagnosis, you'll be much more happier than anything. Nowadays, everyone gets ultrasound, MRI. I diagnose clinically every patient. I diagnose clinically. I tell my patient, this is your diagnosis. Go get the test done. Then you come to me. Then he comes to me, sir. This is the same thing. I say, it is clinical diagnosis. So you can miss a clinical diagnosis. A lot of things are there clinical. Like if you avoid hematuria, you said it can be due to dehydration. If you avoid hematuria, there are a lot of reasons can cause hematuria, from renal cell carcinoma, bladder carcinoma, to renal stones. Like now, just now we are discussing a case of the penile fracture. The patient was giving that he had erection and there is a hematoma here. So this is a clinical diagnosis, as simple as that. My colleague, some colleague is there, he counsels the patient, he told, I will not get operated. So what will happen in the later stage, he will come to us after 1 year and will tell, sir, it has gone cardiac. So the most important thing, clinical diagnosis, you can miss any time, but do examine and do get the relevant investigation now. Now in this era, investigation should be done, because the patient can sue you. To prevent yourself, do the investigation. To make yourself happy, do the clinical diagnosis, and everything will be yours. Anybody more, or
Thank
should
you,
we close
sir.
the session?
Hello.
Yeah.
Good evening, sir.
Yeah, please.
Good. Sir, first of all, thank you for this insightful session. So I wanted to ask that since when we get selected after NEET, we just move out of our houses and stay at places like PGs and all. So in front of my college, we actually have a lot of cafes and all. Usually get influence from our friends and end up having our food from there. And we don't usually pay attention to our water levels and other drinking water and all that. So how does it affect our kidneys in long term, and what should we do to just avoid it and like that?
See, the first thing is that you have to, if you want a good body, you have to control your tongue. Okay, if your friend is eating, it doesn't mean that you should also eat. Okay. The second thing is that if you are eating, you should make sure what healthy thing you are eating. Okay. The third thing is that if you are not willing, nobody can ask you to eat it. So eat healthy there also, you get a lot of things. Once in a while, in 15 days, it's okay. But daily, you should not get influenced by your friend or anyone. I know when you sit in group and all, if he is eating, you also eat. That's a common thing. But still, I say that don't get involved in all this. Do what you like for your own body. If you don't worship your body, your body will not worship you. And if you have a health, you can do anything. If you don't have a health, you will run behind health after some time.
Thank you so much, sir.
Sorry, I'd like to speak again.
Yeah, please.
Dr. Vaibhav, I'm very much impressed. As a young urologist, you have been very assertive and very, very clear. And the way you took up the questions, I'm really impressed. And our medical students, hats off to them for choosing you. And very well framed questions, very, very practical. And only one last message I would like to give to all our youngsters is some of our youngsters seems to be very apprehensive about their health, about what they are eating, etc., etc. Well, what I advise to all my patients is, I also have junk food, you also have junk food. We cannot get away from it. What all that we have to do is, let us eat what mommy has cooked for us, and in addition,
ma'am.
add the junk food.
Right,
And
ma'am.
this principle kindly try to follow as much as possible. Suppose you are a South Indian and you are having idli sambar, try to eat idli sambar along with that pizza or junk food or what burger. If you are a North Indian, you are having paratha, chapati, search for those chapatis, and along with that you take junk food. And as Dr. Vaibhav put it very clearly, control your tongue, but make it a combination, and too excess of anything is dangerous. We
Right,
lost
ma'am.
Puneet Rajkumar just because you know the background. He was a voracious eater and a voracious, what to say, he used to do exercises. Today night he has lots of biryani. Next morning he is there in the gym. So that excess of anything is dangerous. So this apprehension, my sincerely telling all my youngsters, don't have the apprehension. If you really have the apprehension, go to your doctor, get your health checkup done. The first health checkup is your blood pressure, and definitely BMI and GRBS and all that. And your lipids will give a clue to what you're eating, and we will be
Right,
able
ma'am.
to
Right, ma'am.
take care of you better. Thank you. Thanks for giving me
So
time.
truly,
Bye,
truly, you have
and
put
good
it in
luck
a
to
nutshell,
Vaibhav.
ma'am. You have put in a very small nutshell, and everything you have described, what we should eat, what investor should follow, and all. What I want my juniors, I keep guiding them. They keep asking me. I feel free. I make them free. Feel free to ask. So still, MBBS first year, feel free to talk to me. I'm assistant professor in neurology. They feel free to talk to me. I said yes, you should feel free because being a senior, if I cannot guide you, there's no value of being a senior of me. If I cannot teach you, still from my OT or my OPD, I take out 1 hour time, 1.5 hour. I go to classroom, teach them and come. Even I take online classes because if I cannot transfer my knowledge to my junior, it's worthless for me. My sir has already told, if you don't teach, you're doing crime. You should not take whatever you have read to upside. You should transfer here to everyone. Make one surgeon, make 10 surgeons, this 10 make 100, and that explosion should go on.
Yeah, that's right.
Thank you, ma'am.
And
Thank you, everyone.
and you said about the clinical diagnosis. Somebody was asking what mistakes you can do. See, whenever you are in doubt, you consult your colleagues, particularly your seniors and your
Yes, ma'am.
teachers. That's one message I would like to give. And then you can always put forth to the patient saying that today I've come to a provisional diagnosis, and you'll have to come back. So call the patient again and again. If in case you are not able to give the correct diagnosis, that is one way of holding on
Right, ma'am.
instead of making mistakes.
Right,
Thank
ma'am.
you.
Right. I never hesitate to ask your senior. Till you are a junior, you have a senior, you will be asking. When you are a senior, you will hesitate to ask. And nobody will teach you because your co-colleague will be knowing, you will not be knowing, you will feel shy and you will not ask. So till you are junior, keep asking your senior. Once you are a senior, you will never ask on your own. I make sure that. That comes in your mind that I'm a senior, he is my colleague, he knows I don't know, you become shy, then these things keep happening.
Even then, no need to hesitate. I am senior.
Right.
I still discuss with my youngsters. I never hesitate. Infertility, robotics, all that has
Right, ma'am.
grown like anything.
Right, ma'am.
So never hesitate to discuss and clarify your doubts with your teachers and colleagues and classmates, friends, everybody.
My one question is there, how do you decide between extracorporeal shock or lithotripsy versus rotoscopy versus PCNL in daily practice. See, if you see a kidney, the calyces. So upper and the middle calyx with a low HU unit. HU means how hard the stone is. Less than 1800, I go for ESWL. Upper and middle. If lower calyx, you go for RARS or PCNL. Stone is more than 2 centimeter, you go for the PCNL. That's a recommendation. Okay. And ureteroscopy, already ureteroscopy tells you ureteroscopy in the ureter. The middle and the lower ureter, you can go for the semi-rigid ureteroscopy. You can do you can do the URSL. Or upper ureter, you can go with the flexible, do a URSL. And in the kidney and all, I already told upper and middle calyx, low HU, 1 centimeter, ESWL, lower calyx, more than 2 centimeter, or upper middle calyx, more than 2 centimeter, PCNL, or RARS, you can go with that. This is all about, this is a broad thing. I just nutshell. If you any doubt, you can ask me, mail me, no issue. I'll tell you the answer.
Thank you so much, sir, for answering all the questions. And I would also like to thank Dr. Anuradha, madam. Ma'am, you have shared your advice with us, and I think tonight.
Golden advice, not advice. It's a golden advice. You don't get anywhere.
Yes, sir. I agree, sir. And I think tonight we all walk away with clearer understanding and valuable takeaways that we can actually apply in our day-to-day life.
You should.
And thank you so much, ma'am and sir, for joining us today. Now I request Dr. Jaspal Singh Talia, sir, to offer his remarks on today's session.
Thank you, Dr. Vaibhav, for a very, very informative and elaborative session. आपने जो एक खेद रहेगा कि 250 मेंबर ज्वाइन करना चाहते थे and we could not allow them. I think we will require a session with you wherein we will allow more number of members on the platform to join your session. Okay, you have been a very important resource for all our students for their CKD related questions. And I think Srinidhi, you can plan one more session with Vaibhav sir in future that we can accommodate the members who could not join for today's session. Thank you very much. Thank you, Vaibhav ji.
Thank you, sir. Thanks a lot, sir. Thank you, IMA KSN Karnataka, choosing me. I found some time. I read a lot of papers and all. So it was like that. I just put it everything in a nutshell and very informative and explanatory method that you should understand.
Yes. Thank you, sir, for your remarks.
Happy Ram Navami to everybody.
Happy Ram Navami, ma'am.
Yes, government. Thank you. And now I think we can conclude the session. Science and technology.
Yes,
Thank
sir.
you.
Yes, sir.
Yes,
I request Srinidhi to deliver the vote of thanks.
Thank you, Vaibhav sir, for coming and speaking on our request. So, on behalf of IMA Msn Karnataka, I would like to express our sincere gratitude to you, sir, for delivering such an insightful session. I have no words, sir. You made so many topics very clear for all of us, I think. So we are carrying a good advice as well as a clear concept with us today. Thank you so much, sir.
If you want, we can have online classes also. Half an hour, 45 minutes. I love teaching. I have a lot of PPTs with my own cases. So if students are interested, we can put 45 minutes of online class so that I will with teaching with the PPTs, you learn much more better with my own cases, videos and photos. That will make you remember everything.
Sure, sir. Definitely. We would like to have more sessions with you. I would come up with another plan, sir, so that you can share your link to the IMAMS in Karnataka as well. There are a lot of interested students who are eagerly waiting to learn. So thank you so much, sir, for joining today's session and guiding us. I would also like to extend our thanks to Dr. Veerbhadaya sir, Dr. Surila Juvi sir, Dr. Jaspal Singh Telia sir, Dr. Avin Alva sir, Dr. Anuradha Parmeshwar ma'am for their guidance and support. My sincere thanks to our fellow team members for their teamwork in organizing this session. I would also like to thank Shreya Sridharan and Dr. Gaurav Jaydev for their support and coordination. Finally, I thank all the participants for joining us today and making this session successful. Thank you, everyone, and have a wonderful evening. Good night.
Thank you.
Thank you.